Peter Lekevich here, resident physician on the geriatric unit, talking today with Anna Bansilla, 93-year-old female patient who's hospitalized here. Anna, hi. Can you say hi? Hi. Do you know why you're in the hospital? Okay, no. How do you feel? You don't know how you feel? Do you have any pains anywhere?
All my body sore, all my body sore.
Okay, all your body's sore. Has that pain gotten worse or better recently? Okay. How's your appetite been? Have you been hungry?
No.
No. Do any foods interest you more than any others? Okay. Do you know why you're in the hospital now?
Вставайте.
Okay. How old are you, Anna?
I forget.
You forget. Okay. Do you know what year you were born?
No.
Okay. Do you know what year this is? Okay. Do you have any children? Okay. What's the name of your daughter?
Victoria.
Victoria. Okay. Do you know how old she is?
Sure she knows.
How old?
72.
72. Okay. Does she live with you?
You got to.
Okay. Okay. Is there anything I can get for you at this time now? Okay. Do you want to sit up in bed?
Rest.
Okay. You want to rest? Okay. Do you want... Pardon?
I'm sick.
You're sick. Okay. Do you want to sit up in a chair today?
Not too much.
Not too much. Okay. Do you feel kind of low? Is things not too happy? How do you feel? Okay. Okay. Interesting. Her affect is such that that's what one of the purposes for this interview. She's had a history of depression in the past, previously treated with ECT therapy approximately 15 years ago. I'd like to speak with her daughter, Victoria, who just to comment about her past experiences and mother's affect prior to and post ECT therapy, which was performed about 15 years ago. Victoria, tell me about your mother approximately 15 years ago.
Well, she was in a distressed or depressed stage as she is right now, and Dr. Boniface gave her this treatment, and she came right out of it.
Okay. You stated she was not talking at that time?
Yeah, she was mad at somebody, I don't know, and she went into this depression for some reason. I don't understand it myself, but I know that it did help to get the treatment.
Okay. How was her appetite then?
She wouldn't eat, and she wouldn't drink, she wouldn't talk, and it was all corrected.
Okay. She received electroconvulsive therapy at that time, and how would you say was her response after the treatment?
I would say it was good.
Okay. What did you notice different?
Well, she started to talk, and she seemed normal again. She just came out and talked, that's all.
Was the period of time years afterwards, months after, days after the therapy?
Well, I don't think I understand your question.
After the therapy,
Yes.
when did you notice the change? Quote, like a new person.
It seems to be instant. That is, after they brought her in from, she was sitting out on a chair in the hallway in the psychiatric ward, and she was talking. I don't know how long after the treatment, because I don't know when she had it.
Thank you. A treatment with ECT, which will be approximately 48 hours from now, see what effect, if any, has on this nice elderly woman. Thank you. Good morning, Mrs. Bancilla. How are you feeling today?
Not
Not so good? You're going to have a little procedure today, okay, that you've had before. Okay. Okay. Have you eaten anything this morning? Okay. Okay, now we will go ahead and proceed with the ECT.
Okay, what we're giving her is intravenous Brevitol, which is a fast-acting barbiturate, which should put her to sleep very shortly. We're following this up with intravenous succinylcholine, which is going to control the contractures from the seizures. Now we're hyperoxygenating the patient to make sure that her O2 level is sufficiently high so that during the brief period where she is not breathing on her own, we don't have to worry about her becoming hypoxic. Now the patient received 160 volts initially for 0.6 of a second, and we increased that up to 170 volts for 0.1 of a second, which we have to do in some cases where they will not convulse on a lower dosage of current. Now we're simply oxygenating the patient until the effects of the succinylcholine wear off and she's breathing on her own. Now this is the first time we've done this patient, so that the next time we do it, we'll lower the dosage of anectine, which is going to allow her to convulse a little bit easier, and we won't have to repeat the treatment. So let's cut her down next time to 0.5 cc of anectine.
160.
Now, if we're interested in morbidity figures, morbidity, and I mean morbidity, not mortality, with electroshock is 1 in 60,000. Morbidity with tonsillectomies is 1 in 20,000. So that complications with EST are much less than complications with a tonsillectomy, which is a fairly routine procedure.
Interviewing Mrs. Bancilla after her third shock treatment. Notice she's standing up in the bed. The previous ones we've had her supine in bed. We'll just have a little chat here this morning. Mrs. Bancilla, hi.
honey.
How are you feeling today?
My finger.
You feel with your fingers, huh?
Yeah.
Very good, very good. How old are you?
Oh, I forgot.
You forgot. You told me last time.
Well, I keep
You're not keeping it in your head, huh?
yeah.
Have you been hungry lately? No, huh? But you've been eating good.
How you know?
I've been watching you.
Okay.
Okay, you've been eating cornflakes?
That's the kids eat.
That's what the kids eat, huh? Would you like to say anything else? How have you been feeling lately?
Bene.
Pretty good?
Yeah, steppe mamma sa vede per mine.
I don't understand that.
Dice non sti.
No. If you can notice, she's much more alert, smiling, eyes wide open, a totally different facial affect from prior tapes.
Ma aflu bine mulțumesc la Dumnezeu.
Okay. She speaks Romanian, so there's a little language barrier here as well. Cover your eyes. Cover your eyes with your hands. Okay. Now, what did I just place in your hand?
Pen.
Very good, a pen. So she seems to understand what we're talking about here and is very much alert compared to prior episodes here. Do you want to go home soon?
Yes, sir.
When would you like to go home?
Well, my mama. My home.
Where's your home?
In Youngstown, Ohio.
Youngstown, Ohio. Very good, very good. Okay. Do you want to look in the camera? Okay. Wave bye. Wave bye. Okay, we'll see you. And again, this concludes our third tape.